Start.
Just going to do my hand hygiene and I'm going to read the patient notes. So I have here Kane Dobson, so he's been transferred from high dependency ward to trauma ward, has a history of MVA, high speed, he's fractured to the right tibia and fibula, and fractured right ribs ×3. Observations are between the flags, has a left IVC which has been removed, and I'm patient encouraged to do deep breathing and circulation and incentive to patient complaining of pain, 6 out of 10 on deep inspiration. Doctor has prescribed analgesia, morphine suspension to be given as charted. All good. Alright. Hello, Kane Dobson. How are you?
I'm good.
My name's Alex. I'm one of the student nurses here at Western Sydney University. So I'll be looking after you, and I've just had a read of your notes, and I can see that you had a bit of an accident. You've got a bit of pain. Is that correct?
Yes.
Yeah. No worries. The doctor's tried to use some morphine, so I'll give you that in a moment. But I just want to confirm your identity, if that's okay. So I'll just get you to state your full, your first and last name.
Yep.
And your date of birth. So what's your name?
Ken Dobson.
Date of birth.
31st/3/94.
And I'm just going to check your MRN. It's 0956742. Yep. And are you allergic to anything?
Penicillin.
No worries. And what do you get when you, like, if you take penicillin, is there some, like, a reaction that you get?
Left face swelling.
No worries. We won't be giving you that. We'll just give you some morphine.
Yep.
Okay. So I'll just go and prepare that. I'll be back. All right. But before I do that, with that pain, so what would you score your pain out of 10?
6.
6. And you get that's more pronounced when you
Yeah.
breathe in. No worries. All right. I will get that prepared for you. So I'll be back. Okay. And you've got your call bell on your bed, so if you need, just call me. All right.
Okay.
Alrighty, so what I'm going to do now is I'm going to get my medication order, which I have here, and I'm just going to validate that. So I have the patient sticker fixed, and I've got the right patient, which is Kane Dobson. I have the drug section filled out, and I've got penicillin recorded here, so that's good. Click the reaction. I also have it dated, and I've got the medication part included and filled out correctly, which has been signed and dated by the doctor, and I've got the morphine hydrochloride dihydrate, so I'm happy that's a validated order.
Yes.
Now what I'm going to do is check the MIMS book to check information about the medications. So it's on page 234. So I've got here morphine hydrochloride, so it's an opioid analgesic used for pain. It's not indicated if people have hypersensitivity or respiratory depression. We've got these precautions if they are going to have withdrawal or any renal hepatic impairment. Some adverse effects include respiratory depression, circulatory depression, and GI upset. So as a nursing consideration, that's what we need to consider. And in terms of dosage, I've got here that it's a 5 to 20 milligrams for adults. So this, what the doctor tried, is a safe dose, and I'm happy to give that. In terms of observations, I know the documentation said that the observations were between the flags, so I'm not concerned about his respiratory rate or blood pressure because it's between the flags. So I'm happy to give this medication, and it's safe to do so. Now, what I'll do, I'll get my second RN, who's holding the camera, will come with me. So if you would like to come, and we'll open up the dangerous drug cupboard together.
Yes.
So I've got the key here. So, alright, so I've just taken the medication out of the DD cupboard. First, I'm going to check the balance. So according to the register, there should be 50 mils.
Yep.
Now it's a 100 ml bottle. It's halfway, so that's 50 mils. So I'm happy that the balance is correct.
Yep.
Now, what I'm going to do is my first drug check. So the balance is correct, doing the first drug check. So I have here the right patient. So I'm going to use the 5 rights. I've got the right patient here. We've confirmed that. The right drug, which has been charted, which is correct. The right date and time. Due now has not been given. Right dosage, 15 milligrams. A right route, which is an oral suspension. And it's been signed by the doctor. and the medication is in date. That's the first drug check done. Now I need to calculate the dose. So for the calculation, we're going to use the stock required of a stock strength times volume. So the stock required is 15 milligrams. Stock strength as per bottle is 5 milligrams. And the volume is 1 ml because it's 5 milligrams per one, which gives us a dosage of 3 mils. So I'm happy with that calculation. Are you happy with that? So 3 mils is what we're going to be administering. So I've calculated the dose. Now I'm going to do my second drug check. So I've got the right patient, the right drug, as according to the drug, right route, right time, right person, right dose, 3 mils, and it's in date. So I've just done my second drug check and I'm happy with that. Right medication, yep. Now I will dispense the medication adhering to aseptic non-touch technique. So I've got here my oral syringe, which is an orange one. And I've got my medication. So I'm just going to draw up 3 mils. Perfect. So I've just dispensed my medication of 3 mils. So once I've done that, I'm going to do my final drug check. So I've got the right patient, the right drug, the right dose, which is 3 mils. Yeah.
Yes.
Right route, which is oral, and the right time. So I'm happy with that. So that's my third and final drug check done.
Yes.
Now what I'm going to do is document what we're dispensing on the DD book. I'll just get my second RN to co-sign that.
Yep.
Yep, just sign that. Thank you.
Yes, signed.
Thank you for that. So I am now going to put my drug back in my cupboard and lock that up. DD book. Got my medication. Got my chart. Now I'm going to go to the patient bedside. So I'm going to enter the patient bedside now.
Okay.
Hi, Kane Dobson. I'm back. I'm doing my hand hygiene. I'm back with your medication. So I'm going to give that to you in a moment. Before I do that, I just want to confirm your full name and date of birth, please. What's your name?
Kim Dobson.
And date of birth?
31st 394.
And just checking your MRN 0956742, which is correct. So I'm happy with that. I've confirmed the patient's identity, so this is the right patient that we're going to give the medication to. Alrighty, so I've got your medication here. Just open up your mouth.
Yes.
Alright, done. So that will take effect soon. I'll come back in about 30 minutes just to check on you, just to make sure everything's fine, okay?
Yep.
Alrighty. If you need me, just call me. So I've just administered medication. Now I'm just going to sign my chart.
Yes.
And I got my second RN to co-sign with me.
Yeah.
Yeah, just co-sign. Thank you.
Yep.
Alright, so once that's been signed, I can put the chart back away in the patient's folder, and I'll just card off my rubbish.
Yes. Yes.
And before I leave the patient bedside, I'm doing hand hygiene.
Yep.
Alright,
Thank you.
Thank you.